This is truth from the ground up.
So I'm here with Dr. Jaketra Bryant, healthcare therapist, expertise in family systems, trauma therapy, and managing anxiety and depression, and also a 2025 Truth Telling Micro Grant Fellowship recipient, award winner, to help in her work. Let's get to the heart of it. Tell us about your work and what drives you to do it with this micro grant.
Yes, yes. So, I was literally just having this conversation with somebody. I may sound cliche, but the heart of what drives me is family. I honestly believe in the family, and I feel as if the family has been broken for centuries, sadly, centuries, not months, not years, but centuries. And I feel like a lot of the reasons are systematic. It is due to inequalities, inequities, and a lot of disparities. And so I've been after a lot of those a lot I've been after a lot of different I've been after a lot of different solutions from a lot of different angles. And so yeah, so I guess what is really driving me is I really want to mend the family back together. And I'm seeing that incarceration is one of the biggest things that's keeping families broken. Homicide, violence, youth incarceration, um, multiple incarcerations, injustices, all of that is a contributor.
Yeah, and it would seem like something like that is there's sort of a chain reaction with that to where when you talk about families, there's like a generational effect on those types of things. What can you, when it comes to that what you're trying to address, can you describe a moment or experience where that made you say like, this is where I need to focus my energy?
Yeah, I actually entered, let's see, I was a um just a baby to this field actually. And I think I'll back it up from there. Um, I wasn't even in the field. I prior was working at group homes, and I didn't even have a master's yet. I was living in Atlanta, Georgia, and I finished college at the University of Alabama. And I just moved to I just moved to Atlanta, and I was working inside of a group home. And inside of that group home, every family that was representing there was not kin to one another. It was just a melting pot of just families. And it was a revolving door of just kids and a bunch of different family members. And I watched them have no visitation, just nothing. And I listened to the stories of them having been at multiple group homes and multiple foster homes, and maybe possibly having been at foster homes and returned. And I just was like, this is heartbreaking. Like, where is your mom? Where's the original dad? Where's the original aunt? Where is anybody that you're kin to? And kids were like 16, 17, just kind of waiting to age out just so they can quote unquote be on their own. And I was like, this is not family. This is some system here. And it was just
Right.
really heartbreaking. And I was just like, this is not okay. And I was probably 23 seeing that. And just remember being like, I don't like this. What can be done? And
Yeah.
I keep in mind, I'm the group home direct care staff, and I'm just basically in charge of kind of in keeping supervision and count for the kids and making sure they're all together and minor group activities. I'm not even a clinician at that point. And so I'm feeling really helpless. And so I at that point I don't even I'm not even looking and going to get my master's. I'm actually trying to go into medical school. And so it was another direct care staff person who actually was getting her master's. And she noticed just my I guess I must have been having some conversations that were just very enlightening and probably inquisitive. That's me. And she was like, you need to go get your master's in counseling. And so
Hmm.
that was actually a trajectory of my life, just working at that environment and just seeing all of the different kids and just not liking it.
So that would be basically you just saw what something wasn't working and you had to fix it.
Yeah. And I've been after fixing things for the longest. And so as you know, you just find many broken pieces. And
Uh-huh.
so I just kept finding many broken pieces. And there I found that there were multiple issues there. There were issues because at that point I didn't have the knowledge that I have now. And when that led me to the master's. I applied and I got right on in. And I remember them asking me, what do you want to do? And I said, I'm going to open up my own group home. I don't want to do that anymore. But I was like, I'm going to open my own place and they're going to have a place to go. And they're going to be one unit of family. And so that was what I said. I don't want to do that anymore. And so but it led me to my master's program where I then started understanding family systems a lot better. And inside of that, I really started studying like how brokenness and emotional regulation and family environment and social environment play an important role in decision making and problem solving and effective problem solving and human development, and how all of that makes a difference as to how we respond, have a relationship with one another, and how that happened. And that was a big turning point for me as well, because there I learned exactly how to address the solution.
Mm. So, and using those tools you picked up and using them to break cycles of incarceration, can you walk us through like how that actually looks in practice, and like what does a actual breakthrough moment with a client or family sound like?
Supporters like you help us bring history beyond our walls and into the community. Make a gift today at go.civilandhumanrights.org/gift.
Yeah. So and I can speak on like how I did my particular practice. So I combined so I have a PhD in leadership. And so I felt like I had mastered clinical. So very early on, I've been pretty inquisitive, as you can see, like prior to my even becoming a clinician.
Right.
So I actually used a lot of my leadership, like PhD portion. So the researcher, by looking at like the data of high crime rates and high crime area in Columbus, Georgia, is what I focused on. And I focused also on what other interventions are actually out there and that might be working or are just in place. And so I did some research there. There are none. There are programs, but there are not programs in mental health. There are juvenile justice interventions, but they are interventions for the sake of they're not even for the sake of mental health. They're just like interventions. Let's kind of keep them off the street, task force.
Right.
But we have no mental health programming that actually focus on family systems, period here.
Mm.
They focus on like tutoring. They may focus on like they dabble here and there in mental health, but like they didn't have any. So that was something that I started looking closer into. I noticed that like in Columbus, there was also a increase in homicide. So but the homicide victims, when I moved here 6 years ago, the number was actually, they were one of the lowest ranking in Georgia. And then they moved to one of the top. And I was like, screw, something's wrong. And then,
Yeah.
but if you let them tell it, they've cleaned up the numbers. But when I did my research, yeah, they cleaned up a little bit. But if you go to the age bracket in which whom is still affected, it's actually still the teenagers, and it's still the millennials. So it's still the young adults and kids. And so you didn't clean it up. And so like that didn't happen for real. And so I like that was part of my research, which helped me to target a certain audience and a certain group where that was also the high gang population. So I also found out that kids were joining gangs as early as 10 and 11, and they were dying as early as 13.
Mm-hmm.
And I was like, well, if they join as early as 11, dying as early as 13, and homicide is up, and the families are broken, we got incarceration, we got school shootings, then I need to get in there for families and address certain things, because we got no interventions here. And the people that are addressing task force just going after the drugs and going after trying to get maybe they're missing certain stuff to get them off the street. We're missing all of it. Probably by 2030, all the kids are going to be dead.
Right. Yeah. And I didn't realize that Columbus was where you're based in and where you're doing your work. Because you're hitting close to home. That's my hometown right there.
Oh wow.
So I'm happy to hear that somebody's actually doing some work there.
Yeah, I need more people. Yeah, for sure. Yeah, when I found out it was just me, and I was just like, oh my goodness, they have like a couple of partnerships, but the people that are partnering are not addressing any of that, because that was the first research that I was doing. Is there anybody else out here that is actually cleaning it up and addressing the family system? Is there anybody who has identified the root a little bit, that's not just kind of like band-aiding it, that's not going after just drugs? And I was like, you can't just go clean up drugs and get the chief of the drug dealer and think that that's about to clean up a neighborhood without having some conversations. And so like another extension of answering a question, what all my research and stuff, like the process looked like, I actually, in that, I started then targeting the area that actually had the highest gang-related movement. And so I didn't run from it, I went toward it. And so my group is hosted in, like Valley Healthcare, which is on like one of the poorer sides of towns, where they offer community like resources. And I house my group there. And I remember right before I had my group and I was still recruiting, the CEO called me and she was like, Dr. Brown, we gotta like get your group started. Like she was like, literally a young man just like ran through our building this evening, like, and had just gotten shot, and he just ran through our building. She was like, my heart is still racing. And I was like, oh, and she was like, yes. And she was like, the kid was 16 years old and he had just been shot and he ran from somebody. And I was like, what school is over there? What school do you go to by any chance? And she was like, Spencer High School. And so like, after that, I started targeting more of the high schools. And I like started sending out like my like marketing recruitment to like the high school that kid belonged to, and other high schools, to the school counselor and to the principal, let them know I was having a group. I didn't back off when I heard of where the gangs were. I like went in more. And like, I was like serious. I was like, you don't run from where it's at. You go toward it for the information, like for the
any doctor would do, right?
Yeah. I was like a storm chaser for real.
Yeah.
Join our volunteer team. Whether you're greeting guests, leading tours, prepping activities, or supporting events, your time and energy will help bring civil and human rights to life for every visitor. Visit go.civilandhumanrights.org/volunteer to get started.
So as far as your work with the micro grant, like what did the micro grant itself make possible, and that wouldn't have happened otherwise?
Yeah. So part of like one of the extensions that I wanted to do is I wanted to run some of the data so I can see what's happening, and what I thought was happening is happening for sure. And I wanted to like build a relationship within the communities and within those families. And I wanted to get some of the like the families like the rapport built. So I was able to run data, number one. So that was good. So I can actually get some newer statistics. So as the doctor researcher, I know about newer data. So I'm like, you got old data. These kids are still dying. And so I wanted to get some newer data, and I wanted to also like continue a grant. So I was able to write another grant that the city council like offered that was on crime prevention. And I used the fact that I was already researching through this one to write another one. And I partner with like Enrichment Services. They're nonprofit. They sponsored me so I can write that one and ask for a larger amount of money to actually then help 80 families. And so now, like, I should find out at the end of the month if I get that amount, and I'll now like advertise and recruit again, and like now expand it to like 80 families. And so and keep it growing, and I'll get a year. to like, you know, keep cycling the groups around. And then while I was in there, it allowed me to like the groups, the members of it. I actually had a very, very high profile, like ex-gang member who the special ops in the city hates. And he is a person who is like turned his life completely around. So I had some high profilers in my like group. And I also had like a family who like, it was a teenager who was killed and by another teenager. And it was like it was high profile like referrals. I was like, oh my goodness, I landed it for the first time, like running this like group. So that kind of like also helped. And then so they were referring other mothers and other family members. And so I should actually like come out with just a waiting list shortly, as soon as I like announced like the second part. And then I've like since then, like Second Chances, like has connected. And so it was exactly what I wanted. I wanted it an opportunity to have more families know that they don't have to sit with the anger, and the siblings don't have to shoot their way into feeling better, or like they don't have that their options aren't, let me go into a gang, let me retaliate through shooting and killing or hiding. Because the likelihood of, if you have a sibling that's either incarcerated or killed through gang violence, you're going to likely be on one of the ends yourself. You're going to either go and like join a gang, or you're going to likely go to prison. Like the likelihood of that is much, much higher for you. And so the cycle continues unless you get in there and address it. So I was so glad that I have a family that came with like 8 people that signed up. And so I literally have about like 5 of them are boys. And I'm like, yes, like that is a good generation, like that I can address right there.
Right.
And that I can really stop that cycle. And so it was like things like that really made me feel really good. Just addressing something like that and passing that word on, and really just like knowing that, okay, we're part of really addressing and stopping this. And then again, I'm staying inside of the neighborhood that I'm getting, I'm keeping an eye on, and I'm keeping an eye on where else am I hearing that the kids are dying.
Mm-hmm.
Who else is a leader? like what's, how can I get the leader in the group? So
Right. So with what you're doing and engaging with these families, like what kind of signs have you seen, or if you've seen any so far, that that the people that you're working with are starting to sort of rewrite their story, and from survival to something more.
Yeah.
Our programs show what's possible when we invest in truth, healing, and the future. Your support makes it all happen. Learn how we can build what's next together by visiting go.civilandhumanrights.org/gift.
Sure. One of the guys for sure, every meeting, he's like 19. Every meeting, he started off by being like, okay, so I got a head nod. The second meeting, the group, we have 6 sessions. The second group, he was like, this was good. This was really good. Can I have your phone number so I can call you just in case something comes up? I was like, you may. And then we were on our 4th group yesterday, and he came to me, he gave me a hug, and he was like, thank you for all this. And so I'm now and so now he's like embracing, he's like hugging.
Okay.
And he's fully, he's making eye contact, he's like looking, and he's like in it, he is involved. And he's super present. And the mom of the person, the kid was shot, and he was shot by another teenager. And so they actually have not gone to court yet. Mm-hmm. And so we talking about fresh. So they were referred by the funeral director. So my flyer had got all around. And so I was like, whoa, okay. And so they were like, but who better to refer gang related than the funeral director? And so the mom actually has signed up for some individual sessions, because I decided to offer free individual sessions while the group was going to the main person. And so not to the entire family, the main person. And so the mom has actually been talking about like her journey and her stuff before like the death of her son, of just kind of how she even like just came to even like her history of drug history, molestation, just all that. And that's what the cycle is. And so my group is called Breaking Cycles. So she's saying her cycle of how her kid basically even came to gang violence, how they even had, how the disconnect. So her kid wasn't even living with her. She had basically like the kid was living with the grandma. So she's saying the cycle. She's saying the harm and all that. And so we're able to like talk about that and address that and like really get to the issues. She was like, I've been waiting on counseling. Like I wanted it. I really wanted it. And so I'm being able to like see the fact that they are really like exhaling and like seeing like purpose. And each session they're like, this was good. This was really, they were like, this one was hard, but this one was good. And then like the other person, because I couldn't recruit 20 people didn't come. And so the other person was the head gang person. And he writes my testimony inside. And he has like, he was in prison like for 25 years and he did 13. And he has since come out and participates in group and has started LLC'd his business and is like wanting to do more mentoring for youth and wanting to like talk to young guys about like where he was and just really like wanting to be like, no, you like, this is not the route for you. And so he will have the pressures of people from the street like that wants him to go back. But he's like, but she's been showing me another way. She's been letting me know that there is another way and helping like get to like just another mental space. So he will often be like, no, I am learning. I'm learning a lot from you. Like there is another way to this. And so like they've all had like some really good positive things to say. So that's been really good to see with that cycle, like really truly like breaking for sure.
That's beautiful. Like it's great to hear all of that, but like the thing that really stood out to me was the hug. People don't realize how powerful a hug can be, especially for young men. Because
he's like 19,
you don't get that,
right?
Express that way, but being able to feels are rushing up.
Yeah. From a 19-year-old, right? They don't walk up to me and give you no hug when you like, and trust me, they like the first group, one of the other teenagers, I had this water bottle and he said that he was like, I didn't look my age, but he knew I was over 40 because he was like, the teachers at my school got that water bottle. I was like, what? So that's what happened in the first group. I was a over 40-year-old. So like, so I was like, what in the world? I said, from the water bottle? So now the boys in the group, like from him, that was a different boy because it's like 5 of them. Now I get an embrace hug. So like literally they like barriers are down because I'm like, what? I was like the 40-year-old, what in the world, from the water bottle?
That's hilarious.
Yeah.
So you got time for one more question?
Yeah.
So just what would you say to future funders or partners who are actually hesitant about supporting just an impacted mental health work? What would you say to them?
I would definitely say like it's a lot of work, but if you do it from a standpoint of like not band-aiding it and actually addressing it from research and evidence-based, as well as like knowing that like maybe coming together as a team. So like it's a team of me. And then I kind of was putting together my team, putting my interns into some research. And then I had to develop like partnerships. So I would say like it kind of can go a lot smoother if you can develop a team with it. And I would definitely say it's well worth it because like there are probably millions of other families like the ones that I'm working with in several other states and cities that do need help. And so like being able to like get in there and find out what's happening per city and address it from a stance of like, I felt like one of the beautiful things that I did is I was looking at what's even here. I saw it already, but I wanted to visually see that it wasn't there for real. And then from there, take some of the angles of some programs that's already working, along with like some stuff that I like clinically knew. And I would say like, go for it. Like sometimes you don't even have to invent the wheel. Like one of the approaches that I'm using is actually like a therapy approach that was successful in Philadelphia, where they saw jail time decrease by 75% and family cohesion increase. And so it was a trial that already had been ran. And so so that's one thing is like, I like extensively was doing research. And so being able to like do that and kind of invest in that and take it seriously. So that's what I was doing. Like I was like really taking this serious. I was like, this may be a micro grant, but we're going to treat it as if they gave me $1 million.
It's $1 million impact though.
Yeah. Oh, thanks. Yeah.
This conversation is part of Truth from the Ground Up, a series featuring the 2025 Transformative Truth-Telling Microgrant Fellows. This fellowship and the stories you've heard are made possible with generous support from the Mellon Foundation. Truth and Transformation is an initiative of the National Center for Civil and Human Rights. It exists to support truth-tellers, community historians, and creative practitioners working to uncover and reckon with legacies of injustice. To learn more about truth and transformation and how you can be a part of this work, visit go.civilandhumanrights.org/TNT. If this story moved you, please like the video, subscribe to our channel, and drop a comment below to let us know what resonated. As always, thank you for watching, and thank you to the communities doing this work and bringing the truth from the ground up.